So, in caring for an upper eyelid incision, you should see it as two parts. The first goes from the nose out to the outside corner of the eye. That tends to be a flatter looking incision with this type of pattern. The second part is what happens out here, where the skin's a little bit more pinched up while the sutures are in place. We care for these slightly differently. On the part that's directly over the eye, we'll use a little saline, often on a Q-tip, to care for these incisions, making sure that the blood that starts to harden gets softened and removed with this type of light saline care. Sutures out here on the outside, and this is a little bit of hydrogen peroxide. Same concept, just with a different fluid. So hydrogen peroxide gets applied to these sutures. Once that's done, you're going to move on to step 2, which is drying. You're going to take a dry gauze and just gently dry the excess fluid that's there. And then the third step is taking the prescribed eye ointment and putting a thin layer all the way across the sutures.